Hi, we're here to do a post-mortem. Tim, tell us about this here particular little fella that has not thrived, and so we've humanely euthanized it.
Yep, he was relatively fine, we think, a few months ago, but then we noticed a bit of a scary tail just every time we're in the paddock.
Yep.
We all noticed him with a shitty tail. He didn't seem to improve on his own, so we pulled him off, segregated him, treated him with antibiotics, anti-inflammatories, and he seemed to pick up a little bit briefly for about a week.
Did you worm him again?
And wormed him, yep. And then he seemed to be getting better, and we ear-notched him. He checked him for he is not a PI.
Yep. BVD.
That was my first thought, was BVD.
Yep. Because the BVD won't let me be.
Yep. But yeah, he, after initially starting to pick up, he just then went downhill, and he's been extremely thin, wet diarrhea constantly over the last week and a half, 2 weeks.
Yeah, he's scoured like Billy when we looked at him just a minute ago. I said, what? I think this guy's gonna have a win. You can see he's dehydrated too. See that? And he's been Timmy's been giving him water and money, but see that eye's a bit sucked back in. What I was going to show you guys is not so much with this one, but it's a reasonable sample with cows that are hypocalcemic or hypomagnesiemic. We can screen the aqueous humor from the eye, even if they've been dead for a while. And it's just a matter of, he's dead, so he doesn't mind. Just poking through the eye. The eye doesn't want to get poked into, remarkably. So just pulling that, see that juice that I'm pulling up in there? And they can test that in the lab, which is pretty cool.
Shows how resistant the eyeball is to needles when you're treating for pink eye. That's actually a bit safer than you think it is.
So thick-walled, yeah. You know, because like I showed you before, when we pop through here to inject our antibiotic and steroid mix behind it, yeah, I normally push the eyeball out of the way and pop through. But yeah, it's pretty hard to poke it into the eye. Alrighty, we can put that into a red top Super Katie. When we don't have one, we can grab it later. And then just call that aqueous humor. All right, then we're gonna post-mortem this puppy.
So yeah, we got to mention that the possibility of a couple of them got their heads into a grain silo.
Yep.
So there's a chance he may have been the greedy guts doing all the damage in the grain silo, and he could have got himself a guts full of grain of wheat.
So he might have cooked his rumen. So things we're worried about is we'll look at his abomasum, which is his true stomach, and we'll be looking for evidence of osteotagia in there. We'll be looking in the rumen for having had a burn from acidosis. And another red herring is there's a bug called Histophilus that can affect the heart, which then interferes with it increases the pressure on the venous side, so that interferes with absorption of material from the gut. So then it makes them scour. It also can give them a big brisket, which doesn't look very gelatinousy in the brisket, but it can give them a big chin. And I think Monique, you said that he was had a big old wobbly chin on him, which they can get that way from hyperproteinemia too. So the way the blood works is the heart pumps on the high pressure side, pumps through the arteries, goes into the tissue, and then that liquid that's out of the blood has to get back into the capillaries to come through the venous side. And what pulls that across is protein in the bloodstream, and that's called oncotic pressure. So that's called albumin, and that protein pulls the liquid back into the venous side. So if they get hypoproteinemic, they can get a bottle jaw because it's not pulling the fluid back out. Or if there's a resistance on the venous side to where it's hard for the blood to get back into the heart, then it just backs up and they end up with an abdomen full of fluid, scoury, bottle jaw, and often a brisket edema, so fluid here. Okay, so normally we cut them with the left side or right side up. Do you remember, Katie? Left side up, right side up? This side, yeah, that's it, the right side. So if it was the other way, if it was laying on the other side, I'd flip it over. And the reason that is because the rumen's on the left, so there's a huge big organ there full of feed material. It'll just get in the way of our post-mortem. So I try to flip them to where they're right side down. As you're doing a post-mortem every now and again, some people think you're sharpening a knife. All you're doing is, if you were to look at this under an electron microscope, as you use the knife, the tip of it gets bent over because it's quite sharp. And all you're doing when you do this is all you're doing is just pushing that back up. So we'll just hang on to that for in between. I'm going to cut from the brisket up to the throat latch there, and then I'm going to cut between the legs and then back up between the legs. And so when I'm on my own, I just hold that out of the way, and I start right at the brisket. Just use my knife goes under the skin. And then I take the leg and kind of hold it out of the way here. You can zoom in a bit if you want there, Monique. Come in and get a good look. And we're just going under the skin. Back there by his little pizzle. And when I get to the back leg, lift that leg up. I'm cutting down to this hip socket there. See that's his hip bone? I'll just lay that back. Cool beans. And I'll throw this over my shoulder, but it's quite dirty, so I'm gonna see if I can get Tim to hang on to it. And what I want to do is go underneath this. Hang on the top bit there, bud. I'm gonna try to go under this shoulder blade. When you hang on to stuff, you don't want to hang on to it like this. You want to hold on to it like that, so you don't cut the tips of your fingers off. That way you can count to 10.
Where it starts looking like an episode of South Park.
Heading down to South Park and have myself a time.
And was it the aliens coming in and turning the cows inside out?
That's it. All right, so now we want to go into the abdomen. We don't want to cut the guts. If you cut into the guts, that's a carton. So there's a really good trick for that. You just come in right behind the ribs here. There's a bit of a vacuum there. So as you cut into it, the guts are going to fall away, so you don't cut into the guts. Then you take your knife, turn it around like this. Ta-da! Presto changeo.
Master at whack.
Cool beans. Now this is called the omentum. It's like stop leak for the cow. So when they get a puncture and things like that, the idea is it'll come in. So it's attached to the duodenum. So here's the abomasum. Goes up the duodenum and comes across. So what we do is we trim that out so we can see everything, because it's kind of boring. And it attaches to the rumen. So there's the rumen there.
Yep.
That's the guy that gets in the way. Now when I've got a scenario like this where there's been some scalding going on in the rumen, sometimes you can feel it, you can feel plaques on the lining of it. But I'm just going to leave all that there for now, because once you start going into there, things get pretty shitty pretty quickly. I'll just kind of have a quick gamby, see what's going on. We got what we call serous atrophy of the fat. So look at this fat. See how you can see through it? That's because he was in pretty good nick, and then something happened to him that made him stop putting on weight, and his body's digesting his fat, and when it does, it turns to like this clear gelatinous sort of stuff. The last fat to get chased by the body is around the kidneys and around the heart. So when you got serous atrophy of the fat around the kidneys and the heart, he's pretty much used up all his other fat. So the body stores fat all over the joint, and when it goes to clean it up, it ends up looking like that gelatinousy stuff. Cool beans. Looking at the liver there.
What kind of time frame do you reckon he's been burning up his own fat? Just the last few days or the last few months?
Oh, like you say, he's been crooked for a couple months, eh? So he's probably just been going backwards. He reached a stage where he couldn't compensate anymore. All right. So then the next thing I want to do when I'm in here is I want to see if the abomasum is adhered to the diaphragm. Oh, look at this. Come on, check this out. See that there? So the liver is adhered to the body wall.
Yeah.
So that's pretty wild. And when I feel in here on the back of the liver, I'm feeling along the reticulum, looking for a wire, but that liver is adhered to the body wall. So it could be, like you said, he got a bit of acidosis, and maybe what he ended up with is what they call portal cable syndrome, where the rumen got compromised, bacteria went through the lining of the rumen, it went through, hit the liver, put abscesses in the liver, and that's why the liver's adhered to the chest. And then from there, those same abscesses can end up in the heart. Yep. So we'll see if we see some stuff there. So that's where we're gonna go next. We're gonna leave all this alone for now. And I'm gonna cut between the ribs. So when you go down with your knife, you're gonna come down, and then you're gonna hit the bottom. When you hit the bottom, that's where the sternum is. Turn your knife sideways. And what's what they call the costochondral junction, where the ribs attach to the sternum.
sort of fluid is it? Is it blood? That's that browny colour stuff?
Yeah, a bit of so he's depositing fluid. This is what you call pleural fluid, and so for some reason he is producing pleural fluid. So again, that could be that hyperproteinemia like we were talking about before, or could be that he's got like an abscess in his heart or something. It's not working. But looking into this chest, see the way that everything looks in here, it looks a bit unhappy. Oh, there's a bit of fibrin in there. So we got that. And then feeling along his diaphragm, it feels quite lumpy and bumpy and doesn't feel good. And that's the same where we've got all that liver stuff on the other side. So I want to go see what the other side of the lungs look like. So I come over here. So I can check this other lung. The lungs themselves feel pretty good. So yeah, definitely some weird pathology going on there, which could be, and we'll see what we see in that heart in a minute. So before I go diving into there, I'm gonna come up here and look at the trachea and the esophagus. So you got your voice box, and it's suspended in the bottom of your neck by what they call the hyoid apparatus. It's like this little bony structure that holds it up. Okay. So now I've got that all laid out. That's that shuts whenever you and covers your trachea whenever you swallow food. And here's the esophagus up here. So the first place I want to look is in the esophagus, see what we got going on in there. We look at that for ulcers and things like that. Looks clean. Then we're gonna look in the trachea. These are the arytenoid cartilages where you can sometimes get infection there, and they kind of make a roaring sound when they breathe. Get that open. Have a look at his trachea. That looks good. Everything looks pretty sweet. Let's start putting some stuff into some jars. Can we grab I'll grab you a bit of fresh lung. So you try to find something that's a little bit abnormal, if you can. And when you grab abnormal stuff, you want to grab it at the junction between the really abnormal and the somewhat abnormal. Check out how that liver's adhered to that. Where that diaphragm's been that same fibrin that we're seeing in here on the liver side, which we'll see in a minute when we go in there. So it's like the opposite side of that adherence. So for whatever reason, that's decided to get all this fibrin, so it's all abnormal. Let a fresh lung. So fresh stuff, we want nice big chunks. For fixed stuff, we just need real thin stuff. A little of that, would you? Thank you. There you go, in the forearm. All right, let's check out this heart. Coming into there's the heart inside its pericardial sac. A little bit of pericardial fluid there. Nothing too abnormal. Gonna cut into these different ventricles. So when you think of a heart, you're holding it like that. And then these are called the auricles. So they call them that because they look like ears. And the way you can tell what's what is you pretend like you're shaking hands. So that's a person's left hand. Hello, nice to meet you. That's the left auricle. That's the right auricle. So the left side of the heart is what pumps to the body, and it's thick-walled. The right side is what pumps to the heart, to the lungs, and so it's much thinner. That's the valves. These are called chordae tendineae, and these little valves are what snap shut. So a little bit of blood pours through that one-way valve, then the heart goes squish, and that seals up, and then it pumps it out through the aorta, and it goes to the body. So that's the aorta there. Little spot there. Bloop, bloop, bloop. See, there he is there, cut with a hole cut in him. And that all looks pretty good. So we'll be looking for bacteria and stuff in here if it did that portal cable syndrome that I was talking about, and that all looks clean. We're also looking for acidosis, as a bacteria that gets in the lungs or the heart, which can cause that sort of fluid buildup that we're talking about. And that all looks pretty clean. So that's cool. We're going to come back into the right side of the heart, which pumps to the lungs. There's those chordae tendineae in there, and that one-way valve I was telling you about, and that cut up there to the auricle. All looks sweet. All right, so put in a bit of fresh heart. And I'll give you a little bit of heart for histo. So in the histo, it gets preserved in formaldehyde, and they look at it under a microscope. Make tiny little cross sections of it. Cool beans. That's good. Here's an abscess there. This liver is adhered to the... And that liver's quite rounded edges, which also happens when they start to kind of use up all their fat. It goes up to the liver and says, all right, make energy. And the liver says, well, I need sugar to make it work, because of the citric acid cycle or the Krebs cycle, if you're an old fella like me. And when it gets there and if there's no sugar, it goes, all right, cool, we'll have to wait till we get some sugar. What are we gonna do with it? I'll just stick it in there. And so that's why the edges are round. And these will float. So if we put this into water, which is a bucket of water there, isn't there?
There's a trough just over there.
I bet you this floats. Ooh, and that's really quite congested. Look how dark that is. Central lobular congestion. Let's see if it floats. Nope. So I think instead of it being full of fat, that's full of blood. Like blood is all backed up. Wow, crazy. Bit of fresh liver for you, and then that's nuts. A bit for the formalin, again nice and thin. Alrighty. All over the liver. Oh yeah, just so thick. That's the gallbladder, because he hasn't been eating, it's full. Yeah, that's just nuts, all that adherence to his liver. Cut in a bit of that, I reckon.
Bit of cool pathology there. In the photo, yeah, please.
That is just a crazy liver. Normally, liver's kind of a nice brown color. This is wild. We'll see what comes back from the department on that. All right, let's go get these kidneys. Kidneys are right up here. They're encased in fat. They got serious atrophy of the fat happening. Normally you can just rip the kidneys out. This kidney's quite enlarged. It looks pretty normal. You can see that serious fat atrophy of the fat. All right, get a little fresh bit of kidney, gorgeous. Bloop. And then for the histo, I want a nice cross section all the way through what they call the renal pelvis, so you can get all the different layers of that kidney. Fantastic organ, that one. Oh, get back here. There you go. All right. Working our way around. Here's abomasum, and here's stuff kind of blocked up here at the bottom of his abomasum. That's interesting. Could that be what's blocked him up and why he started going backwards? Maybe. See how this is his abomasum? So what happens is in the rumen, all the stuff gets chewed up, and then it gets pushed through. The abomasum grinds it up, and it comes into the abomasum, which is here. Ooh. Could I get some one of those yellow containers, and I'll get some of this in it? Thank you. Thanks. It's pretty gelatinous. We'll see what they find on this, but I'd say he did have some ostratalgia. So see the kind of the little raised nodules on there and stuff, which is probably where the encysted larvae have come out. What worm are you using, brother?
Which one did this guy get?
That got doramectin, I think.
Doramectin?
Yeah.
Are you using that Doramectin V yet?
No, we're just kind of bouncing between Doramectin and
Moxidectin?
Yeah, Moxidectin's cattle guard, isn't it?
So this was blocking out his outflow. Looks like a bit. This fiber smush. Looked a bit impacted there, but it's not too bad. Sometimes it's full of sand, and I think it blocks them up. There's not much going on in his duodenum past that. Everything's just kind of knotted up in there. What have we got going on here? Fuck, we see some interesting stuff, brother.
So that's not a normal part.
No. It's like he's got a clot, and that's why his liver's so jam-packed full. Like, I wonder if he's got a big clot in his abdominal vena cava. So and that's why the liver's so fat and full of blood and congested like it is. Interesting. Can I chuck some of that into a container, please? Water. rectum. Foreman. Wow, he's got. Can I get a container and I'll give you some cecal fluid? Whoop. Ready? Oh, sorry. There's some water bucket there.
Being a vet nurse isn't all about puppy dogs and kittens, is it?
She's our large animal girl. She loves it. She loves the poop.
So there's a bit of like weight or something in there, and he hasn't been fed grain for a while. Do you reckon that's does it hang around or?
No, it could well be oats out of this hay.
Yeah, okay.
I would have thought.
Wow.
Right, so it does look like oats actually.
Bizarro, team. I'll bring over that container for me. Thanks. Sticking some big stuff.
What are we looking at? That's weird.
See the kidney. He's happy. Alright, let's look into this rumen A. Bit of rumen contents if you want on one. Man, I'm making a mess of your yards. Yep, just rumen contents, yep. Put on the hormone. I reckon that liver was just backed up.
Not in a good foie, however you pronounce it. Duck liver leg.
Yeah, yeah. Duck pate, or whatever they call it. Shit, yeah. Nice and good.
He had a surprisingly good appetite in here. He's made through a fair bit of hay in the couple of weeks he's been in this pen.
I don't think he was probably eating it. He just couldn't digest it.
Yep.
It was all just going to his liver and just sitting there. This liver is just massive. Bizarro. We'll see what the department comes back.
Nothing obvious so far.
Well, it looks to me like the blood was unable to drain properly out of his liver.
Yep.
And so I think he's got a congested liver full of blood, which is what he's got a liver like you'd expect to see with heart failure, but his heart seemed okay. we found that big kind of clot there at the back. So I'm wondering if he had an outflow obstruction of his liver, where the venous return on his liver was compromised. And then he couldn't digest anything because his liver's abnormal. So all the food he was eating, he couldn't build protein and things like that. So he started to accumulate fluid and started to essentially starve to death because he wasn't getting anything out of his tucker.
Yeah.
Huh.
So not the stomach lining was all pretty normal. Doesn't look.
He probably was a bit wormy at some stage, but
So-
not severe.
Yeah, and not a case of acidosis.
Don't see any evidence of that. No, unless he's recovered.
Yeah.
And that could be kind of what could have happened. Maybe that he had showering in the gut, and then the gut ended up blocking out. There's that funny little lesion that we found is right there. So it was quite discreet. Oh man, that is a crazy liver. Dynamite team, I've made a big mess in your yard.
It's alright.
Woo.
Cows, the dogs will reckon it's good.
Dogs are gonna love it. Right arm.
Will that liver